shortness of breath?
No. There shouldn't be any shortness of breath, they tell me.
Good.
The main thing to be successful in nursing is just to really have a good attitude. You never know what type of patients you're gonna get. You never know what physicians you're gonna be working with, trying to have your patients have a good day. And sometimes your patients a little flat, they're depressed, their family's worried, and you wanna make this stressful time good for them. I think really the art of nursing is, truly being a chameleon, being able to adapt to different personality situations. You have to work in really high stressful environments where you're moving fast, and it's difficult.
I got to Methodist because I had a heart murmur for years, and I researched heart surgeons. I thought it was time to try and develop a relationship to someone that could fix the leaky valve. I'm optimistic. I just want to leave better than I came in.
The collaboration between cardiology and cardiac surgery starts from the point that the patient is seen in the clinic to the actual performance of the procedure. TAVR has become the standard of care as long as that anatomy is suitable. Patients between 65 and 80 years of age, there is often a discussion based on patient's anatomy for TAVR, patient's physiologic risk of surgery, and patient preference. So these decisions are carefully made in conjunction with a heart team which consists of a cardiac surgeon and a cardiologist, and of course the patient, depending on what is ideal and most suitable for them.
My name is Alexis Jones. I work at Houston Methodist Hospital, and I've been here for a little over 2 years. I currently work on Walter Tower 20, which is a cardiovascular unit. A couple years ago, my grandmother was diagnosed with stage 4 pancreatic cancer, and throughout her illness, she did 80 rounds of chemotherapy. At that time, I was still in school, wasn't really sure what I wanted to do, and then I met this nurse named Jenny, and she was actually the hospice nurse that took care of my grandmother. What I loved about Jenny was how compassionate she was, her personality, how exciting she could be throughout a really difficult time in my family's life. And she made a really big impact in my life, just really showing me the ropes, really how to be a good person and really take care of someone. So we'll pop up on here and go all over your medicines, your next appointments. Okay?
Okay. Just breathe normally. So I'm Sachin Goel. I'm an interventional cardiologist here at Houston Methodist. I also serve as the medical director for structural heart interventions. I've been here at the Houston Methodist DeBakey Heart and Vascular Institute for 3 years. So interventional cardiology is a subspecialty in cardiology, and we specialize in interventions. And these can vary from putting stents in the blood vessels of the heart for blockages, treating patients who come in with a heart attack. And my area of expertise really is structural interventions, which essentially means catheter-based valve repair and replacement. In other words, repair and replacement of heart valves without open heart surgery. Looks really good. No bleeding or hematoma. You can sit up. Once we dry you out a little bit, you get out of here, you're up and about at home, you should start feeling a whole lot better.
I think Walter 20 has some of the best satisfaction scores because we're awesome. But really the main thing is we have a really high turnover rate in patients. Typically our patients are on our floor for 24 hours to 48 hours. And during that time, it's important for us to promote really good care and get our patients out.
Broadcast to Walter Tower 20. Good morning, everybody. Discharge planning is now starting in the conference room. Please make your way to the conference room for discharge planning.
So typically for coordination rounds, we meet every single morning at 9 a.m. Monday through Friday, and we discuss things that are holding our patients back. Let's say if there's something that they need, whether that's a physical therapy consult, if they need to transition from the hospital to a rehab facility. Those are things that we discuss during rounds, and we like to see what we can do to change that, to make their stay easier and to get them home faster. All right, room 30, Mr. Bernard Brown. He is going home today. Getting to discharge a patient is always great. You're excited to see them going home with their families. And not only are you serving the patient, but you're also serving every single family member that's there. And I know, just kind of going back to my experience with my grandmother, I'm a hospice nurse, just seeing the amount of care that you provided to not only the patient, but to their family as well, was very rewarding. It was an exceptional experience, and it was truly an honor taking care of that patient.
I think that unit is a special place. It seems to be a very well-oiled machine, and I don't think we could have done all this without the help of Leanne and her fantastic team of nurses and the staff on Walter 20.
And I have to say that everyone that I've dealt with here have been the nicest, most friendly, sweet people you could ever hope to meet.